Welcome back to my channel. Today in this video we will be proceeding further, that is the synopsis of oral pathology, and in this video we will be discussing some of the syndromes related to disease of blood, periodontium, skin diseases and so on. Okay, so let's start with the blood first. In the blood we have five main syndromes. So let's get started to them one by one. This video is very useful for those who are preparing for MDS preparation, MDS exams, as well as for those who are going to have their final year exams. So yeah, like third year and final year students, they can see this video. It's very informative for them because in this video I will be collecting the information from various sources and making it easier for you to do oral pathology in the simplest way. So let's get started. First of all, we have Fanconi anemia. Okay, so Fanconi anemia, it's not a syndrome. Let me tell you one thing, Fanconi anemia and Fanconi syndrome are two different things. You can see in the note, Fanconi anemia and Fanconi syndrome are two different things. Fanconi anemia is different from Fanconi syndrome, which is a rare kidney disorder. Actually, Fanconi syndrome, it's a rare kidney disorder, so it's not related to blood. So if we are talking about blood, then we will be discussing Fanconi anemia. Now, what is the features, what are the characteristic features that we're going to see in Fanconi anemia? In Fanconi anemia, we have aplastic anemia. Do you know what aplastic anemia means? Aplastic anemia, it's actually a disorder of bone marrow in which the stem cells, it's a disorder of stem cells due to which all the blood cells, either RBCs, WBCs, every like platelets and all, everything. So the number of all types of blood cells is reduced. That is aplastic anemia. So all the blood cells are reduced. So it's the first feature, that is aplastic anemia. Then we have microcephaly, as I've told you also earlier. Like, what is microcephaly? Microcephaly is actually the less head size, or you can say smaller head size, as you're gonna see in, yeah, it's microcephaly. The head size of the baby is reduced. That is microcephaly, as I've told you also earlier. Okay, so it's aplastic anemia, that is the stem cells in the bone marrow are less, and that's why the less red blood cells, white cells and platelets. In aplastic anemia, stem cells are damaged. As a result, the bone marrow is either empty, that is aplastic, or may contain few blood cells, that is hypoplastic. So what aplastic means, that is completely absence. Okay, so cells are very less or maybe absent. Okay, so after this we have this aplastic anemia, we have microcephaly, we have hypogenitalism. Do you know what hypogenitalism is? That is, hypo means less and genital means genital organs. So obviously genital organs are poorly developed, as well as there is olive brown pigmentation. You can also see some pigmentation on the skin. So when all these features come together, it is aplastic anemia, microcephaly, that genital organ less development, as well as olive brown pigmentation comes together as a Fanconi anemia. Then we have Palmer-Winson syndrome. So you have also heard about it in your earlier classes, and it's basically a triad. It has three things. इसमें तीन चीजें होती हैं. एक होता है आयरन डेफिशिएंसी एनीमिया, बंदे में आयरन की बहुत कमी होती है इसलिए एनीमिया हो जाता है. Plus it's a carcinoma of hypopharynx. Do you know what hypopharynx is? We have three parts of pharynx. First is nasopharynx, then we have hypopharynx. Hypopharynx is just behind your epiglottis. So that part of pharynx is hypopharynx, and carcinoma is like cancer formation in hypopharynx. Then we have chylomalacia. Do you know what chylomalacia is? That is spoon-shaped nails, like shape of the nails is deformed. So we have three things: iron deficiency anemia, hypopharynx carcinoma and chylomalacia, that is in Palmer-Winson syndrome. It's very important. Then we have Eldritch syndrome. So what is Eldritch syndrome? Eldritch syndrome is basically a skin disease in which we have, first of all, there is thrombocytopenic purpura. Do you know what it is? It's basically platelet count is less. Thrombocytopenia, less platelet. So thrombocytopenic purpura. Then we have eczema. Eczema is a type of skin disease. A kind of rashes appear on the skin, that is eczema, but eczema is different from your psoriasis. Like people usually confuse between eczema and psoriasis. So yeah, this is eczema and this is psoriasis. It's a little difference. In psoriasis, you're gonna see like something is popping out of the skin, elevated, as well as there's something whitish color also seen in psoriasis. That's the difference. So in your Eldridge syndrome, we have thrombocytopenic purpura and we have eczema. After this, we have increased susceptibility to infections. All these things like eczema, less number of platelets, as well as infection susceptibility makes Eldridge syndrome. Then we have Chiari-Higashi syndrome. Chiari-Higashi syndrome. In this, we have like a number of things. First of all, we have lymphomas, multiple lymphoma. Do you know what lymphoma is? Lymphoma is basically lymph tissue related. It's like a cancer of lymphatic tissue. Lymphatic tissue is a tissue which helps in the defense of a body, that is lymphatic system, spleen, thymus, all these things, they make up the lymphatic system. So carcinoma of that tissue is lymphoma, and it's multiple lymphomas. After that, we have albinism. Do you know what albinism is? Albinism is lack of pigmentation, lack of melanin formation. So the skin looks like कुछ लोग बहुत गोरे गोरे लगता है, तो ये albinism का शिकार होता है. This is like albinism. तो यहाँ पे जो हम बात कर रहे हैं हिगाशी सिंड्रोम के बारे में, चियारिक हिगाशी में, इसमें लिम्फोमा दिखाई देंगे, एल्बिनिज्म होगा, बंदा बहुत गोरा गोरा लगेगा. Nystagmus. Do you know what nystagmus is? Nystagmus is nothing special, but it's like different type of thing. Like इनवॉलेंट्री आई मूवमेंट. ऐसा लगता है कि बंदे की जो आई है वो इस तरह से रैपिडली मूव करती है फ्रॉम वन साइड टू अनदर. आँख की जो अंदर का जो बॉल है दैट मूव्स लाइक रैपिडली फ्रॉम वन साइड टू अनदर. दैट मूवमेंट इज निस्टैग्मस. ठीक है, तो बंदे को निस्टैग्मस होगा, उसकी आई मूवमेंट्स अबनॉर्मल होंगी, बंदा बहुत गोरा लगेगा, लिम्फोमा होगा उसके अंदर, उसमें रिकरेंट इन्फेक्शन के चांसेस हैं. साथ में उस बंदे को फोटोफोबिया होगा. लाइक फोटोफोबिया इज लाइक अगर आप फोटो खींचेंगे उसकी तो उसको इट्स लाइक फोबिया, डर लगेगा उसको. साथ में उसको जिंजोवाइटिस होगा ओरल मैनिफेस्टेशन में, प्लस ग्लोसाइटिस. ग्लोसाइटिस का क्या मतलब होता है? टंग जो होगी वो बड़ी हो जाएगी साइज में, टंग का इन्फेक्शन, दैट इज ग्लोसाइटिस. So that is about Chiari-Higashi syndrome. Then we have Costman syndrome. So what is Costman syndrome? इसमें कुछ नहीं होता, बस एक चीज होती है जो बहुत सीवियर होती है, दैट इज न्यूट्रोपीनिया. न्यूट्रोपीनिया इज लेस नंबर ऑफ न्यूट्रोफिल्स. ठीक है, न्यूट्रोफिल्स का नंबर बहुत ज्यादा कम हो जाता है और ये कॉन्जेनाइटल होता है, बाय बर्थ होता है और सीवियर फॉर्म ऑफ होती है, दैट इज कॉस्टमैन सिंड्रोम. सो दिस इज अबाउट द syndromes related to your blood. In next video I will be dealing about syndromes related to periodontium and skin. So that's all for this, and if you like my video and you found it helpful, then do subscribe to my channel. Thank you.